Welcome to the media briefing today. Today, the speakers are Dr. Zhang Kwan, Head of Communicable Disease Branch of the CHP, and Dr. Gladys Kwan, Chief Manager of the Hospital Authority. First, Dr. Zhang will tell us about the new cases. Good afternoon. Yesterday, we recorded 114 positive PCR cases, including 20 from the HA, 19 from our CHP's public laboratory, and 75 from private laboratories. And also there were 215 RAT positive cases. Altogether, the total is 329. So far, the accumulative number in the fifth wave is 1,126,000 cases, including 745,194 PCR positive and some 450,000 RAT positive cases. So far, today, 35 are imported cases, including 25 PCR and 10 RAT positive cases. 19 cases were found at the airport. 8 were those arrived in Hong Kong on the 30th via 5 flights. 11 cases were arrivals the day before, that is the 29th, via 3 flights. 16 cases were found in quarantine hotels. They were cases with samples taken on the 3rd or the 5th day. Today, we have no new cases from residential care homes. For schools, there are 27 positive reports from 24 schools, including 20 students, from 6 kindergartens, 8 primary schools, and 6 secondary schools, and 7 teaching staff from 5 primary schools and 2 secondary schools. Among the 27 cases, 26 were found via RAT and 1 via PCR test. 13 are tested positive today, 11 tested positive yesterday's afternoon, and 3 from previous samples. 5 schools have seen 2 to 3 cases in the past 7 days. For 3 schools, the cases are epidemiologically linked. 2 cases were from the same school, but are not from the same class and are unrelated. In 1 school, that is a school with special classes, there were 9 classes with 4 teaching staff. So 2 teaching staff and 2 students were found to be positive a few days ago. The last went to school last week between the 24th and 26th. Today, that school reported 1 more case, which was actually a case on the 25th. That is a teaching staff who was tested positive on the 25th. So since the 25th, when the first case occurred, the school has switched to online teaching, so no one came back to school. And all other teachers and students have been tested positive recently. So it is possible that the outbreak has ended. For another school, there are 2 cases from the same family in the same class. 2 students from another school are from the same class. The 2 students did not have without mask activities, so we will keep monitoring the 2 schools. For death cases, the HA has no new death case to report today. The total number of deaths reported by HA is 9,087. In the 5th wave, the total number is 9,165. They include 3,783 females and 5,380 males. For the other analysis, it is the same. Now, the variant Omicron BA.5, we have 1 more imported case with the strain caught at the airport on the 25th of May, a 23-year-old male returning from the UK carrying the BA.5 variant. For BA.2.12.1, for this subvariant, we have 6 more imported cases. Altogether, we have 78 imported cases with this subvariant. For the local BA.2.12.1 cases, that is the McDonald cluster, there is one more suspected case of BA.2.12.1. The whole genome sequencing result is still pending. That is L452Q. The patient works on the first floor of the Hong Kong Center for Exhibition and Convention. He is a warehouse staff. The workplace is different. However, he went to the same restaurant for breakfast with the other patient. He has been doing RAT every day. On the 26th and 27th, the results were negative. On the 26th, he felt unwell, and on the 28th, he was tested positive. On the 27th, we went to the canteen to take 150 environmental samples, as well as from the changing room. All the environmental samples came back negative. Because of the emergence of a new case, for those who have been to the restaurant for breakfast between 7:30 a.m. to 8 a.m. on the 25th and the 26th of May, these customers will be subject to compulsory testing. For the clusters from Central, we have 4 more cases, so far 27, 12 females and 15 males between the age of 17 to 37. Most of them had an onset on the 24th of May. For Iron Ferries, we have 10 more cases. Altogether, 32 cases from the cluster, 13 males and 19 females aged between 18 and 54. They had onset between the 23rd and the 29th of May. More than half of them have symptoms, and a dozen of them don't have any symptoms. So that's all for my report today. Now, Dr. Kwan, please update us on the HA situation. Good afternoon. There are 419 confirmed patients receiving in-hospital treatment. 47 are new patients. Among those who are in ICU, in isolation wards, 73 are in isolation wards, and 14 are in secondary tiers isolation wards. 34 patients are receiving treatment in the North Lantau Infection Control Center. 12 are new patients. Yesterday, we reported 1 critical patient. However, there were no serious patients reported. Among those in-hospital patients, there are 10 critical and 8 serious patients. 5 critical patients are receiving ICU treatment. Yesterday, no death cases were reported. For the past few days, 56 patients have recovered and 46 have been discharged. In the 5th wave, so far, 50,288 patients have recovered, including 49,875 patients discharged. Since the year 2020, there are 62,208 patients recovered, including 62,255 patients discharged. Yesterday, no patients were tested positive on admission to hospital, causing patients or staff members to be listed as close contacts. For our staff, 23,238 staff members have been infected. 23,204 staff members have returned to work. Thank you. Now we open the floor to questions. Please raise your hands and use our mic to ask questions.
Please identify your media organization before you ask your questions. Good afternoon from Cable TV. So there have been over 700 customers in the 2 bars. Have you tracked them down? How many? And have you ever analyzed the whole genome sequencing? Have you found the origin of the of the disease, and since many of them have not been wearing masks, would there actually be a penalty and would they be penalized? And I would like to ask about the whole genome sequencing. Is this BA.2.20 for the 3 at Mount Parker Lodge, and also for the new case from the McDonald cluster? Where did the person transmit the disease? And for the 51-year male, so do you know the genome sequencing? And this is now the day of the third round of the vaccine pass. So how are you going to track down all those infected cases? Well, at the bars, we find that there is still over 100 of them that still need to go for testing, because about 700 customers in both bars, and so there's still 100 which we have not yet identified. We will remind them to go for the compulsory testing. Altogether, in Iron Ferries, there are 32 cases, and in Central, 4 new cases. So altogether, there's 27 cases. So these are all found via the vaccine pass. For the whole genome sequencing, we still do not have the results yet, but it doesn't seem that there are any new subvariants. They seem to be mainly local epidemiology strain, so we do not see any new variants for now, but we will still need to look at the results of the genome sequencing. Those from Mount Parker Lodge seems to be transmitted with BA.2.12.1 because one of them lives in the same building as one that has the Omicron BA.1.12.1. But for Mountain Terrace, we still do not have any new information yet. The new case, the one who works at the Hong Kong Exhibition Center, since that person has been taking meals at the canteen, there's a bit of an overlapping time with the 2 other cases, so it may have been infected during that time. But the canteen has already been cleansed and sterilized. We have taken some environmental samples but have not found any positive samples yet. We would once again impose a compulsory testing order to see whether we would find any new cases, because during the incubation period, that person took meals there. I think it's around May 25th and May 26th. We hope that those who have eaten in the canteen would go for testing another time to see whether we could identify any new cases. We see from the trend that it's pretty much stabilized, but we will continue to monitor the figures. Next question, please. I'm from News. Well, although we've seen about 200 cases in the past few days, we see there's been an upward trend recently, and today the number has reached over 300. Some experts said that antibodies after being infected would maintain for around 3 to 6 months. Well, it's now about 3 months since the peak of infection cases. So what do you think of that? And since we've been seeing new clusters, it shows that there is a transmission chain locally. So how are we going to prevent a new wave from spreading? And the requirements for the vaccine pass have been updated today. There are still about 600,000 people who have not yet taken their 3rd jab. Do you think that there's been enough campaign done, because people might have forgotten to take their 3rd jab? How are you going to ensure that these people would be triple jabbed soon? Of course, we would see a fluctuation in numbers daily. We would continue to monitor the situation. Or we still need to observe the antibodies. Some people say that antibodies will drop gradually with time, but as you know, being vaccinated does not mean that it can prevent infection. It's just effective against a critical and serious condition and deaths. Therefore, there may not be a huge impact even though people are vaccinated. As for local cases, we see around 200 to 300 cases a day, and we've seen new clusters. It doesn't mean that being vaccinated or having been infected with COVID means that we'll be able to cut the transmission chain. The outbreak in the bars and restaurants actually have not been as serious as expected. I wouldn't try to guess why people have still not yet taken their third shot. But if it's time for them to take the third jab, I think they should do it as soon as possible. We've already mentioned the many good points of being jabbed and protected. The gentleman in the back from Hong Kong 01, the chief executive said that it is not the appropriate time to further relax social distancing measures at the end of June. So why is that the case? And some bars say that having a DJ performance does not having DJ live music does not mean that it's a real performance. So do you think that the transmission has been caused by dancing? So would you actually ban people from dancing in pubs? The figures have gone past 300 today, and we see gradually a new surge in clusters and cases. So is it actually a sign of a rebound? We see our figures in around 200 and 300. So you can say that it is still around that number at this moment. So I can say that the real-time effective productive number is still around less than 1. Omicron actually spreads very quickly, and it's difficult to cut off all transmission chains. Many people have been vaccinated, and some people have already been infected. In addition, we have relaxed many social distancing measures. Therefore, it is expected to see a surge in the number of cases. Some people currently are immune because of having antibodies. As for how to handle with the bars, and we will leave it to the relevant authorities. A gentleman over there. Good afternoon from AM 730. I'd like to ask about the 150 samples taken from the Convention and Exhibition Center. So which part were these samples taken? For the BA.2.12.1. So other than the mountain terrace, can you actually tell us more about that cluster? And on the second floor of Taiko Plaza, we see that there's a restaurant that's under compulsory testing. Second floor of Pacific Place. And do you know the transmission in the schools and how many students are there in the classroom? And for the Iron Ferries on Hollywood Road, it seems that the first case was found later than the case in Central. are you aware of how the outbreak came about in Iron Ferries? Are there only 2 people who have visited both bars, and altogether it's a total of 57 or 59 cases?
幾個樣
Concerning the 100 or so samples, those are environmental samples from tables, handrails, toilets, changing rooms, and so on. BA2.12.1 variant, in terms of genome sequencing, the genome makeup is very similar with the McDonald cluster. However, there are no epidemiological links. For example, Lo Shan mentioned Mountain Terrace, Tagushing, and the Exhibition and Convention Center staff, that is the cleaner and the family members. For the dishwashing worker, we are still waiting for the results. Today, we also have cases suspected to carry the BA2.12.1 strains. These are all cases with concrete epidemiological link with the McDonald cluster. And also previously, there was a case from the immigration department. There is also no direct epidemiological link. Most cases from the cluster have epidemiological links. Still, there are invisible transmission chain where we cannot find any links between patients. Concerning the restaurants at Pacific Place, sorry, I don't have the CDNs with me. I mean at City Plaza. So it should be one of the restaurants visited by a person living in the Mount Parker Lodge. That should be a case of a BA2.12.1. For the 5 cases from the schools, for 2 cases, they are from different classes and they have no links. For the other cluster, there are 3 cases, but it is a while ago. There has been no cases in the past 5 days. We will continue monitoring the situation. For the other cluster, those are siblings from the same family and in the same class. The other cluster comprises 2 students from the same class. They know each other, but they don't have any without mask activities in the classroom. So we will see if there are any possible transmission channel tomorrow. Concerning bars, we haven't found the source yet. So the 2 patients went to Central at 10 p.m. and then Iron Ferries. Next question, the lady over there. Good afternoon, I'm from Now TV. So you said there are some 100 people who haven't done the compulsory testing yet from the bar cluster. So is the total number 100 or 100 from each bar? If we do have patients among the 100 persons, what is the risk of a community outbreak? So have you reviewed all the CCTV footages to trace the whereabouts of the patrons? Is there any way to speed up the tracing work? Do we need to set up a tracing center like in previous waves? We have already activated our case tracing office. The tracing work is being done by our colleagues in the office. We have the vaccine pass now, so it has significantly sped up our tracing work. Even if you look at the CCTV footages, you have to identify the person and then find out the contact number of the patron. With the vaccine pass, we can have access to the phone number immediately. Sometimes the calls don't go through, but we will keep trying to contact them. Sorry, it should be 100 patrons from each bar. last question. I'm from Mingpao Daily about the Convention Exhibition Center, the warehouse staff. Does he come into contact with the public, and what did he last work on the 28th? Now we have a major exhibition ongoing in the exhibition and convention center. So what is the risk to the visitors? And 3 patients have visited the restaurants at different times. So how many possible, how many customers dined with them at the same time? Now about the City Plaza cluster, what do you think the outbreak from BA2.1, 2.1 cluster is in the community? Now, for the patients found on the 23rd, we haven't found the patients yet. So, what do you think the outbreak possibility is from the 2 bars? From the CHP's perspective, if the customers did wear a mask and then they dance at the dance floor, and also the DJ did have a mask on, how high can the risk be? The warehouse staff went to work on the 26th, and then he felt unwell and stopped going to work. His job is to tidy up the inventory, so he wouldn't come into contact with the public. So he eats at the staff canteen, which is separated from the other customers. So for the staff canteen, we have to count how many customers were there at each time slot. We have just added a few time slots today, so it may involve 100 or 200 customers. BA2.1, 2.1 strain is being transmitted in the community because we have cases without epidemiological links. They lived nearby or work nearby. Like previous Omicron waves, the variant is highly transmissible. Even if we can track down all the close contacts, we may still see transmission among people who are not close contacts. So we may see transmission in the community, but don't worry. According to experts, the prevailing strain is BA.2. So the prevailing strain is BA.2. So there may be cross immunity because of the strain. No matter the variant, vaccination is able to protect you from serious illnesses and deaths. Subvariants only mean that the transmissibility is higher. The 2 bars, Iron Ferries and Central, I don't think it is very critical whether we can find the source patient. We have 200 cases in the community. Everyone, behind each case, there is a transmission chain. So we are not worried about a super outbreak. We just want to know how big some clusters are in order to reduce the transmission. For regulations in bars, I will leave it to the relevant departments to comment on them. That's the end of the media briefing today. Thank you. Sorry, the speaker is not coming through. 700 each. 700 each.